This is a study conducted by Nisarga Biotech in collaboration with All India Institute of Ayurveda. The number of sites used was only one site, which was the ESIC Medical College and Hospital, Faridabad. Number of subjects were 190. Study period was August to December 2020. This was right in the middle of the first pandemic wave, and the study was registered on CPRI with the CPRI number given on the slide. Next slide, please. Now, why we chose this particular study to be done with extract from neem leaves? Now, we have been studying the neem leaf extract for last 7 years in collaboration with a university in the United States. And we have found that the neem extract we are making using neem leaves as a raw material, which is basically a dried neem leaf. We have been studying the CO2 extract of this study, and we found that the neem formulation created by us has a potent anti-inflammatory activity with reduction in inflammatory cytokines. All the markers which are shown here, IFN gamma, IL-1 beta, alpha, IL-1 alpha, and IL-6. Apart from this, we also found that neem has a very potent activity against the not only just the inflammation, but it also triggers the immune system. We can also see that in a molecular docking studies in influenza, a neem extract could be identified on the binding site. Neem extract has also shown a very promising antiviral, anti-inflammatory, and antioxidant activity. The preclinical studies conducted by us have shown that it significantly inhibits poliovirus, HIV, and dengue virus at an early step of viral genome replication. Its antiviral, anti-inflammatory, and immunomodulatory activity is required to reduce the incidence of severity of COVID-19. All these evidences suggested that neem formulation could be a good prophylactic option for prevention of COVID-19. This was the first of its kind study approved by Department of Ayush to be conducted in collaboration with All India Institute of Ayurveda. We characterized anti-inflammatory activity in vivo and in vitro, characterized the safety of product in acute and repeat dose toxicity studies, the acute toxicity in mice and rat at 500, 1,000 and 2,000 milligrams dose, 28 days repeat dose toxicity in rat at 200, 500 and 1,000 milligram dose, completed toxicokinetics in 28 days studies in rats, characterized the key marker compounds like nimbolide, nimbin, and salinin responsible for neem activity. Next slide, please. It was decided to study the effect of neem to evaluate the prophylactic effect in subjects coming in daily contact with COVID-19 subjects. It was also necessary to assess the safety of these neem capsules and assess the effect of neem capsules on quality of life. Mind you, this was required because at that time no vaccine was available. And as you know that vaccines do have one shortcoming, and that is the possibility of vaccine not working when there is a possibility of the virus getting mutated. So that was the reason why we decided to do this trial. And the endpoints were to note the number of symptomatic cases within 56 days of using neem for 28 days. Number of asymptomatic cases within 56 days. Number of subjects reporting negative COVID-19 test within 56 days. Adverse events reported with Neem capsule and improvement in quality of life of subjects. Now, this was designed keeping in mind the criteria used for vaccines for evaluating the efficacy of the vaccine. Now, the key inclusion criteria was healthcare personnel, physicians, nurses, chemists, pharmacists who work in healthcare facilities or other well-characterized high-risk environments, males and females between the age group of 18 and 60 years of age, agrees not to self-medicate with chloroquine, hydrochloroquine, or other potential antivirals, not previously diagnosed with COVID-19, not currently symptomatic with an acute respiratory infection. Next, please. The key exclusion criteria were known hypersensitivity to Neem products, subject on other prophylactic medications, suspected or confirmed COVID-19 defined as temperature greater than 38 degrees Celsius, cough, shortness of breath, sore throat, or if available, positive confirmatory testing for COVID-19. This was definitely criteria. Subjects who were on angiotensin converting enzyme ACE inhibitors, inability or unwillingness to comply with study or follow-up procedures outlined in the protocol, psychological, familial, sociological, or geographical conditions that do not permit compliance with the protocol. The study was designed as a randomized, double-blind, placebo-controlled parallel design study with visit number 1 for screening, where the inclusion and exclusion criteria were applied, and then the patients were divided into 2 groups. Group number 1, where Neem capsules, 50 milligrams of extract twice a day, and group 2 was placebo-controlled, group with n equal to 100. The visit 2 was after administering the drug for 29 days, and the third visit was follow-up visit after day 56. And the study result was shown by publishing the research. The study was led by Dr. Tanuja Nesri, who is the director of All India Institute of Ayurveda, Dr. Anju Bharadwaj, Dr. Rajagopal, Dr. Krishna, MD. These were all Ayurvedic doctors. And then we also had modern medicine doctors, Dr. Shivani Didial, Dr. Asim Das, Dr. Anil Kumar Pandey, who is the principal investigator on site, who is an MD in immunology, and Dr. Nidhi Chowdhury, MD medicine. So this was a study conducted by a team of Ayurvedic doctors as well as modern doctors. The Ayurvedic doctors were mainly involved only to give Ayurvedic advice, while the modern doctors were responsible on site to ensure gold standards were maintained while conducting this study. Next, please. Now, if you look at the disposition of subjects, the some number of subjects assigned were 95 in each group. The number of patients completing the trial was 70 in Neem group and 83 in placebo group. Discontinuation in Neem group was 25 against placebo 12. Tested positive early on RT-PCR COVID-19 test in Neem group were 2. This was when the patients were taking the medication, but the dose was less than 80%. Then the in placebo group, there was only one person who was tested positive during the medication. 12 patients were lost to follow-up. In Neem group, 5 were in the placebo group. Withdrawal of consent was 8 in Neem group and 6 in placebo group. Poor compliance was in 2 in Neem group and 0 in placebo. And one patient was found to be positive after 28 days of medication, so it was also excluded. Next, please. Now, if you look at the demographic data, there is no difference between the demographics of Group A and Group B, Group 1 and Group B. The weight also has been consistent, and there is no significant difference in the demographic data. Next, please. Now, if you look at the efficacy, subject getting RT-PCR positive during the follow-up period, in case of Neem group, there were only 3 persons who were found to be RT-PCR positive, whereas in placebo group, there were 8 persons. Subjects with RT-PCR negative results were 67 in Neem group and 76 in placebo group. If you look at the relative risk, effectiveness was found to be 55%. Next, please. Now, if you look at the safety, all the reported adverse events were mild or moderate in intensity. They were only gastrointestinal, disturbances. None of the participants developed severe or serious side effects. No significant changes were observed in vitals, hematology, biochemistry, or ECG in either group. Neem capsules given at a dose of 50 milligrams BID were proved to be safe and well tolerated in high-risk subjects. Next, please. Can you bring back the previous slide? Yeah. Now, this is basically just to show you that the adverse events were very mild in Neem group as well as placebo group, and none of the patients was removed from the trial because of adverse events, which proves that Neem was very safe for use in this. Next slide, please. We found that there was no apparent changes in either group in biomarkers after 29 days. There was no change in IgG levels in each group or C-reactive protein in placebo group as well. However, the C-reactive protein increase in placebo group was clinically insignificant. Similarly, no significant difference in biomarker levels were found. Next, please. And if you look at the IL-6, IgG, IgM, and C-reactive protein numbers, though there was no significant change or there was no significant, p-value found in any of these groups, you can see that the C-reactive protein was quite high in placebo group, which indicates that there might be a possibility that the placebo group was showing more susceptibility. Next, please. If you look at the quality of life score, it remained stable in both the groups. At 29-day visit, 2 subjects in Neem group reported improved sleep and appetite, and 1 subject reported improved sleep. At 56 days, 2 subjects in Neem group reported improved appetite, 2 reported improved sleep, 2 others reported increased work efficiency, and 1 reported relief from stress. This was quite interesting because it is not just preventing infection with 55%, it also showed improvement in the quality of life. Next, please. If you look at the conclusions, Nisarga's Neem capsules given at a dose of 1 cap twice a day for 28 days showed the effectiveness of 55% for the prophylaxis of COVID-19 in healthcare personnel or relatives of the patient with COVID-19 infection. If you remember that ICMR guidelines stated that even if a product is effective by over 50%, it should be considered as good for prevention of COVID. Unfortunately, the Indian government could not accept our request because they felt that the size of the sample size was not able to justify this particular claim because of less statistical power. But the fact remains that there was not a single patient going to the hospital in spite of getting infected. So you can really conclude that this was as effective as any vaccine. Effect could be due to antiviral and anti-inflammatory activity of Neem. Previous slide, please. Neem capsules were safe and well tolerated. There was no significant change observed in vitals, hematology, biochemistry, or ECG. Next slide, please. The important factors to note is the study was published in US based in peer-reviewed journal, and it was also accepted on PubMed. This was the first double-blind placebo-controlled trial, which was reported in WHO website as well for any prophylaxis for any natural product. Participants, nurses, wardens, and relatives who were in constant contact with COVID-19, safety of the capsule is also proven as no severe as well as serious adverse events were observed. Next, please. Main takeaways from this trial are safe option for preventing COVID-19 infection until vaccines are made available to all. I will add to this now that the vaccines are widely available, there is no harm in using this for prevention in case of those who are getting infected. Those who are around those people can use this for prevention, because if there is a new mutation, the vaccine may not be as effective as it seems. This can also provide protection up to 55% for those who cannot be vaccinated amid the shortage. There is no special carriage condition required for transporting to the remote places. You can see that a lot of vaccine is being wasted because we don't have the required cold chain. It is an ideal option for everyone to take. Those who are having problem in getting their second dose, they can also use this product until they are vaccinated. This is an effective prophylaxis for reducing the burden on healthcare system in case there is a new peak coming in or new wave coming in for COVID. So I thought it prudent to present this. Thank you very much. Thank you.
For more information, visit our website www.worldneemorganization.org. If you wish to become a WNO member, simply click the link in the description box, or you can visit our website for all the membership details and every Neem update. Subscribe to our YouTube channel and press the bell icon to never miss a video from us. Our social media handles are given right on the screen as well as in the description box. We would like to thank our sponsors for their constant support.